Hello and welcome. Today we're diving into a complex but crucial topic: drug-induced nephropathy, also known as drug-induced kidney disease. We'll explore what it is, how it develops, and what can be done about it. So what causes drug-induced nephropathy? Well, as the name suggests, it's kidney damage caused by medications. Many different drugs can be nephrotoxic, meaning they're toxic to the kidneys. Some common culprits include nonsteroidal anti-inflammatory drugs, or NSAIDs like ibuprofen and naproxen, certain antibiotics, such as aminoglycosides and vancomycin, some antiviral medications, certain cancer chemotherapy drugs like cisplatin, and even contrast dyes used in medical imaging. It's important to understand that while these drugs are used to treat a variety of illnesses, they can sometimes have unintended consequences for the kidneys. Now, let's understand the pathophysiology. Drug-induced nephropathy occurs through several mechanisms. Some drugs directly damage kidney cells. Others cause inflammation or obstruction within the kidney tubules, the tiny filters within the kidney. Still others can affect the blood supply to the kidneys, leading to ischemia, which is a lack of oxygen to the kidney tissue. Certain drugs can also trigger an allergic reaction in the kidneys known as acute interstitial nephritis. The specific mechanism depends on the drug involved and the individual's susceptibility. In short, medications disrupt the delicate balance of kidney function, leading to impaired filtration and potential kidney damage. Understanding how common drug-induced nephropathy is can be challenging, as it is often underdiagnosed or attributed to other causes. Estimates suggest that drug-induced nephropathy accounts for a significant percentage of acute kidney injury cases, particularly in hospitalized patients. The exact incidence varies depending on factors such as the patient's age, underlying health conditions, and the specific medications they are taking. Older adults, individuals with pre-existing kidney disease, and those taking multiple medications are at a higher risk. What are the signs and symptoms of drug-induced nephropathy? The symptoms can vary widely depending on the severity of the kidney damage. Some people may experience no symptoms at all, especially in the early stages. Other possible symptoms include changes in urine output, either decreased or increased, swelling in the legs or feet, fatigue and weakness, nausea and vomiting, loss of appetite, and high blood pressure. In severe cases, it can lead to acute kidney failure, requiring dialysis. It's crucial to pay attention to these symptoms and report them to your doctor promptly. Diagnosing drug-induced nephropathy involves a combination of factors. First, your doctor will review your medical history, including all the medications you're taking. They will perform a physical exam and order blood and urine tests to assess your kidney function. Blood tests will measure creatinine and blood urea nitrogen, or BUN, which are waste products that build up in the blood when the kidneys aren't working properly. Urine tests can detect protein or blood in the urine. In some cases, a kidney biopsy may be necessary to examine kidney tissue under a microscope and confirm the diagnosis. Drug-induced nephropathy isn't always neatly categorized into specific types, but we can consider it based on the mechanisms involved. We might discuss acute tubular necrosis, caused by direct tubular damage, acute interstitial nephritis, due to an allergic reaction in the kidney, hemodynamic-mediated kidney injury, caused by changes in blood flow to the kidney, or crystal-induced nephropathy, where drug crystals block the kidney tubules. These categories help guide treatment strategies. The primary goal of treatment is to stop or reduce the kidney damage. This often involves discontinuing the offending medication. Depending on the severity, other treatments may be necessary. These can include intravenous fluids to help flush out the kidneys, medications to control blood pressure or swelling, and in severe cases, dialysis to remove waste products from the blood. It's essential to work closely with your doctor to develop an individualized treatment plan. Prevention is always better than cure. To minimize your risk of drug-induced nephropathy, always tell your doctor about all the medications you're taking, including over-the-counter drugs, supplements, and herbal remedies. If you have pre-existing kidney disease, be especially cautious. Stay well hydrated by drinking plenty of water. Avoid unnecessary use of NSAIDs and other potentially nephrotoxic drugs. And make sure your doctor monitors your kidney function regularly, especially if you're taking medications known to affect the kidneys. The prognosis for drug-induced nephropathy depends on several factors, including the severity of the kidney damage, how quickly it's diagnosed and treated, and the patient's overall health. In many cases, kidney function can recover after the offending drug is stopped. However, in some cases, the damage may be permanent, leading to chronic kidney disease. Ongoing research is focused on identifying new biomarkers to detect drug-induced kidney injury earlier, and on developing new therapies to protect the kidneys from drug toxicity. Some promising areas of research involve investigating the role of antioxidants and anti-inflammatory agents in preventing and treating drug-induced nephropathy. Keeping abreast of new advancements will undoubtedly improve patient outcomes in the future. Thanks for watching!